Welcome, everyone. We have a wonderful set of program for today. And the idea nowadays, we have got some good feedback from many of you individually as well as, like Panavan got some feedback and some other people got some feedback. And we recognize that there are many breath practices all over all over the world and so many of them. And so there was one suggestion to do some consistent practice so that everybody gets used to doing some practices on a daily basis. So the format we're going to follow now is we will do some practices on a consistent basis, and this you can either make notes of it or you can go to the YouTube, because this is being recorded on YouTube as well. Follow from YouTube. And YouTube address is, you probably know, Breath Lab Dr.Kalind Bakshi. You'll be able to see all the recordings. And then we will add some additional things as per, what the additional practices are, so that people will get a little bit understanding about how we do this. So let's begin today. I'm going to do a very fascinating part of this. Is something that I do on a daily basis, every day. Now, when we are asleep, when we are sleeping, our breathing is continued, breath is continued. But who takes care of it? It's our brain. It's the back part of the brain here, the third part, lower level of the brain, subconscious mind, and it takes care of in such a way that it adjusts the breathing that is needed, even during sleep. Very interesting part. How do we know that? Many times we have disturbed sleep. Our breath can go bigger, deeper. If you have dreams, your breath pattern will change. During the different phases of sleep, it will change. The breathing changes. Now, this is a fascinating part. And what happens here is, therefore, what we are about to experience now is when you wake up first thing, when you open your eyes, the first thing that you realize is that, wow, it's morning, or whatever I'm awake. You start waking up, you start being aware of the surroundings. Then you realize who you are. You're a man, you're a woman, what your name is, where you are. Your awareness starts kicking in. And then suddenly either you have to go to the bathroom, some people want to do that and right that time, or things that happen. I slept okay, I didn't sleep okay, some situation with the backs, neck, whatever, if you're not slept. Or one of the feelings that you get, general body feeling you get, is what? I slept well, or I rested, or I had a dream, I had all this. Your mind start getting into the gear. First thing that happens to most of us. Now, here is a suggestion. Let us develop from the very beginning. As you wake up tomorrow morning, we're going to develop something which is called as breath awareness. Becoming aware that you have been breathing. Somebody has been maintaining your life. Your breath has been maintaining your life. How do you do that? So this is how I wake up, and I will just going to walk you through the waking up procedure that I have followed for a while. And it really makes my day wonderful because I'm able to do this. I just do this almost easily now. It takes a little time, but it's not that difficult. So the first thing, your eyes open tomorrow morning, you just look around a little bit. Whatever position you are sleeping in, it's not doesn't matter. You be side or as your eyes open up, wow, think about that. Wow, I'm awake. Wow, it's morning already. At that time, just focus on breath. Take a nice deep breath. Now, supposing you're sleeping flat, you turn around, sleep flat so that you're on the back, the belly is on the top. Turn around that time, first thing, and just breathe. I'm just going to show you as I'm leaning back on my chair a little bit, and just take a nice breath through the nose, just a little bit. This is a very good thing to do because many of the times the belly breathing is not occurring during night, and the belly breathing is very effective. So you just take a nice deep breath through the nose. Don't keep your mouth closed and nice deep breath. All of you, please breathe. Put your hand here. Breathe in and out. Lean back a little bit so you realize that that's what you're doing in the morning. Just 3 breaths. And then you smile. I enjoy smiling first thing in the morning. You know why? Because if you smile, we always realize that these nostrils, they open up. Smile and take a nice deep breath. More air. And then immediately what happens is I don't have my glasses because the glasses are on the bedstand somewhere. I'm like this. I'm going to wake up. One of the things are that my hand really goes because I want to wake up. Everybody does this, right? Wake up and everything, you do this. So start doing this and automatically just massage a little bit and breathe. Let's massage this and breathe. Inhale, exhale. You are waking up, you have to wake up the face first. Most of the people time that's what happens, and then whatever face you want to make. First you want to make a face frowning, you can do that, but then smile and breathe and say, wow, I'm awake. Thank you. Many people don't wake up, I'm one of them, I'm awake today. So then you massage this area, then go up into the head area, just automatically continue the breath and do a little bit massage right here in the ear, in the front part of the ear. Just massage and a little bit of gum here. Wake up as you continue breathing. And then stretch. Inhale. This is sigh of relief. Sigh. Breathe in. Like that. All of us do this, but do it in a conscious way. Conscious means I'm taking a real deep breath now. And stretch yourself. What is happening at that time is you're getting more oxygen as you deep breathe. Consciously take a nice deep breath and expressing everything out. Whatever the muscles have been laying still. And that time all the substances develop. The stagnation of the lymph and circulation has occurred through the night. So as you stretch yourself, stretch whatever stretches you're going to do, just breathe with that. Breathe in, breathe out. The next thing you're going to do is turn on the side. I'm going to show you, you can do this while you're sitting. I'll show you how it is. When you turn on the side, let's say I'm sleeping like this, okay? Many people sleep like this too. But when you're awake, just turn on one side first. And breathe deep. Inhale and exhale. Go ahead and do it now, everyone. Inhale, exhale. Now what you're doing is you are giving one long because you're sleeping on this side, this lung is compressed, but this side lung is opened up. And what you're doing is you are inhaling to inflate this area. So inhale deeply, exhale. One more time, inhale, exhale. Just think of the entire lung opening up. One more time, inhale, exhale. Stretch again, inhale, exhale. Turn on the other side now. Now turn for this lung to expand. Inhale. Now when you do this, this is an interesting position. Now you can probably just turn and do it, but when you open up your arm, what happens is this is a rib cage here. So many spaces, the spaces between the rib cage that opens up all the way. If you open up the whole thing, it can expand much better. The lung will expand. So that's the reason we do this. Very beautiful, beautiful posture. So take a deep breath again. Inhale. Exhale. Inhale again. Exhale. One more time. You do this. Now the time you are getting awake now, obviously. What you want to do is I'm not able to show you here, but wiggle your toes. Let me see if I can show you. It's easy to do here, not that difficult. So if I'm lying like that, wiggle my toes, inhale and exhale. Bend your knee, just gentle massage there. Continue inhalation, exhalation, because every area of your body wants to wake up, has to wake up. The entire massage part and everything takes me a total of about 5 minutes to do, not more. Just a few minutes. Wake up, all the joints. These all things is important because you will be stable. Balance will be good. A breath balance is important for the body balance. No balance can occur in the mind or the body without balancing the breath. So send it to all these areas. Wiggle your toes. Make sure your hand, all the areas are up. Now, before I get up out of bed, I also want to balance my brain. How do you balance your brain? My left brain is my thinking brain. It's where I'm going to solve all the problems. I'll have a situation going on during the day. I have to, address something that I have to do. Thinking brain. Right brain is the emotional brain. I have to feel my way through. What is the feeling? What is the analysis? What creativity, for example? Creativity, that's my right brain. How do I balance the brain? First thing you do to balance the brain in the morning, you can do it. How? It's a very simple technique, and we're not going to go into details of this. Everyone knows this. It's by breathing through one nostril and then the other. Now, just go ahead and breathe through your left nostril, through your left. I'm just going to do the opposite, but anyway, through your left nostril, breathe in. Now, just think of this: the left nostril, the breath goes in and goes to the right side. Okay, just remember that much. Inhale, goes to the right side. Close the left nostril and exhale. It crosses over and exhale to the right nostril. Exhale. Now inhale through the right nostril. Breath goes up, crosses to the left brain, and then Exhale through the left nostril. So let me do this. I'll just talk about it. You guys do it. Okay. So inhale through the left nostril. Imagine the oxygen going to the right brain, crossing over to the left brain. Close off the left nostril and exhale to the right nostril. Now inhale to the right nostril, crossing over to the left side. This is my thinking brain. So when I breathe to the right nostril, I'm thinking in myself, I want to solve problems. I'm sure I can think about this. Let me be very awake. Let me be somebody that I can address all the issues for today. So put your mind also in that breath. Breath and mind will go together and will make the brain function absolutely fantastic. Inhale to the right nostril, go to the left. Exhale to the right nostril. Inhale through the left nostril. My creativity, my emotions, I have to balance all day. I want to be relationships with people during the day. That has to be wonderful. I know how to talk to people. People will not get angry at me. I won't get angry at people. All that's on this side. Inhale. Exhale. It's that simple. And then as I massage, I don't know if I did this, but massage your gums. Now, as you're waking up, there's one system that comes into picture called sympathetic system. Sympathetic means adrenaline starts working. You're waking up, and activity starts. All the cells are saying, "Wow, good morning" to everybody. And adrenaline and steroid system and all those systems wake up. They have been sleeping. They start waking up. When they start waking up, you don't want to wake up too fast, but you also know how to balance them. So how do you balance? First balance, we balance the brain. The system, the sympathetic and the parasympathetic system, which is the two systems that we want to balance. How do we balance that? We all do this. Very fascinating part. We all do this. But I just want to tell you what it is. We get up, first thing, what we do? We wash our face. Don't we? Most of us do that, right? We splash water on the face. Splashing water on the face, brushing your teeth, gargling, when you gargle. All these things will be stimulating the vagus nerve. Have you heard of vagus nerve? Vagus is parasympathetic nerve. And it balances out whatever the activity is happening during the whole day. If you can really develop a habit to make sure that you go to the vagus nerve, understand what the vagus nerve is doing and how we can balance this. Breathing is an excellent way to do this. Now, one more thing I'm going to do before I invite Deepak Bhai here to share the next practice that I always do when I get up. The practice that I want to make sure that we understand this massage and all this, I'll say that, is to take a inhale. I do counts, okay? I do just counts, just in my head. Inhale for 4, exhale for 5. So let's inhale. 4, 3, 2, 1. Exhale. 5, 4, 3, 2, 1. Inhale. 4, 3, 2, 1. Exhale. 5, 4, 3, 2, 1. As long as I exhale longer than inhalation, just a little bit, 1 or 2 counts, maybe whatever you can do. When you start that off in the morning, you are already relaxing. You're already putting in vagus nerve stimulation. So that pattern, if you start in the morning, you will continue doing reasonably well because you start getting habit in the morning, how you are waking up. And one more thing that we do, and I think Panaman is going to get into that maybe today. I don't know whether we're going to do this, but so one day we'll get in. We have probably done, I need to breathe. You hold your breath. I don't know if you remember that, but if not, we will do it some other time. You inhale, exhale, inhale, exhale, pinch your nose and hold your breath, and then measure the time. Measure the time, how long, not stretch yourself, but first time you feel like breathing, inclination comes, urge to breathe comes, very beginning. That is called I need to breathe time, or BOLT, blood oxygen level test. Now, any of our breath work that we do, this is one of the things that we follow on a regular basis. So that's what I do. I have, of course, everybody has this on next to, like sitting next to the bed or sometimes on me. So I use this and I do my bolt score. I also keep something on the side to write it down. This is an important part. If you do that, if you write down your scores and follow that, you will get the most benefit. Okay. So the next thing we do before I get up, I know I talked to you about washing the face and all, but before I get up, I do definitely do Kapalabhati. And so I'm going to invite, where is he? I can't see him. Deepak Bhai. Okay. I invite Deepak Bhai to lead us through Kapalabhati, which I do first thing in the morning when I sit up in the bed. I do the Kapalabhati, and I'll show you when I stand up, I do something. I'll show you that too. So go ahead, Deepak Bhai.
Okay. Thank you, Kalind Bhai. I learned from Kalind Bhai to do this thing first thing in the morning. So I do that too in the morning. As soon as I wake up, I sit down on my bed and then I do that, several times, Okay, so first I'll describe what is Kapalbhati and how to do it. So like in every breathing practice, we'll, sit straight and posture straight so that all our energy levels are straight, chakras are aligned. And then our foot is resting tight on the carpet. So the posture will be good. During this Kapalbhati practice, we can lay our hands on the thigh or in a lap. Kapalbhati is like a forceful exhalation. Forceful exhalation through the nose, and the mouth remains closed all the time. It is like sneezing, It is like a sneezing, aided by upper abdomen area that moves back and forth or in and out. And and during this practice, we are not inhaling. Mini inhaling is automatically done. So we'll not try to breathe during this practice. In the beginning, we can focus on inward and outward movement of the abdomen, and with a practice, it will be automatic. For those who still haven't done this before, they can start with a slow movement of the abdomen in and out, and but then after the practice, they can do it faster with more practice. So I'm going to demonstrate. So like in the usual, all the practice, breathing practice, we do like, two normal breaths. So this is how it is done, and so now we'll practice. I hope you heard little bit, or maybe you have seen. It's hard to show. So Okay, so we'll do all everybody will do together, and you can do your own counting. Like we'll do only about 15 stroke. We'll do only 15 stroke. Okay. So let's take 2 normal breath. 1, 2. Then inhale and start. So this is how it is done, and the advantage of this Kapalbhati is that it cleans the lungs. It removes a toxin from the lung. It also removes the negative emotions, all our negative emotions. Also, it helps in concentration and focusing. And then also there's one more advantage is like it massages our upper abdominal area. And so that's all about Kapalbhati. Back to you, Kalind bhai.
That was wonderful demonstration. Thank you for leading that. Now what we'll do is we'll practice it, the Kapalabhati. I'm going to be a little bit in the back here so that you can see me better. We'll do the Kapalabhati. We'll do 3 cycles of it. 3 cycles, just sitting. Now, one instruction is very important. Do it at your own pace. Number 1. We don't want to get out of breath here. What we are doing here, we are exhaling with the belly going back. For example, I'm taking breath now, and then if you have to put your hand on the belly and actually press it, it's okay to do. Yogic sciences don't tell you that, but the idea is that's exactly what you're doing. Try that. You can hear me exhaling. But if you do this, okay, just a little hint that you can try doing it. It's a little variation. It's okay. Okay, I'm going to show you that anyway. You can go ahead and do it. So breathe twice. Set up yourself. Inhale, exhale. Inhale, exhale. Inhale. Start. Fifteen. Inhale. Exhale. Inhale. Exhale. Inhale. Start. Inhale. Exhale. Inhale. Exhale. Inhale. Third time. Inhale. Exhale. Inhale. Exhale. It's very important to recognize that this not only cleans up here, but because you are making this noise, we've done a little bit of ocean breath last time. We're making the noise as you exhale in the back of the throat. The entire system gets cleansed up. And the vagus now gets stimulated and it leads to relaxation. That's the interesting part about it. Now, if you had an oximeter on, you may see a little bit increased heart rate initially, and that can happen. But this is to be done at a time in the morning. Now, it also wakes up all the systems too. Even though I said the parasympathetic, it also it starts waking up, concentration increases, awareness increases, the awareness of the body. So Kapalabhati is when I wake up, I do Kapalabhati. You may do longer if you want to, but start with a small number and then slowly increase. And people who are very much aware of it, they can do faster. Faster with a shorter inhalation, small amount of inhalation can be done. Depends upon you how you progress. So Kapalabhati is something that we do. Get up in the morning. Now I'm going to do another Kapalabhati, which is an additional little technique that I'm going to show you. And what we're going to do is we're going to breathe in. As you inhale, breathe in, and then exhale. Breathe in. Inhale, exhale. This the whole, there's a little pressure here, and we are actually pressing from the top, the belly as well. So we are actually expressing everything that is there from the chest, belly, and it is a very biomechanics we are using. It's called biomechanical time. I know this is my term. You can use it. Say Kalind Bakshi said it. It's biomechanical way of doing Kapalabhati. It's also called as Urdhva Kapalabhati. Urdhva means upper. It's described by different means, but for me, because I'm on a little physical level that I'm explaining to you, let's take it. Inhale. It has opened up all the ribs and it has allowed the full breath. Take a full breath. And full breath and full exhalation. Important. Full breath. One more time. And the last time. So you can do the regular Kapalabhati, then Urdhva Kapalabhati. Now you are ready to roll out of bed. This is what I usually do, Kapalabhati. I do it, and I do it not this forcefully. My wife is sleeping; she usually sleeps a little longer than me, and I don't want to wake her up that way. So I do it, a little bit more. Either get up and do it somewhere else, but I'm just telling you how I wake up. And I think if you form a pattern for yourself, whatever is your pattern, deep breathing, whatever, begin a pattern tomorrow morning. Okay, tomorrow morning, you guys are all going to do that, and start doing it on a daily basis. Just how you wake up will determine how your day will be. Okay, so thank you very much for this, and we're going to do some more. But I'm going to invite now Vinod Bhai to share with us a very important way of using a little equipment. We have all seen that. So over to Vinod Bhai.
Hello, everybody. Hope everybody is fine. There was an excellent demonstration of Kapil Bhati. Basically, Kapal Bhati means it's to do with the forehead and shining forehead. That's what it means. And now, as a human being, we need an incentive to do anything in life. Sometimes we don't think for ourselves. So when your breathing is kind of compromised, especially in people who had lung or heart or upper abdominal surgery, or they are weak or tired, they tend to breathe very shallow. And to incentivize them to take deeper breath, the hospital system has come up with an instrument called incentive spirometer. It's a kind of a fancy name for a simple technique of taking deep breaths. So when you take deep breaths, we always been talking about deep breathing all along, that we are expanding our lungs. When you expand your lungs, what you do, you open up your airways, you get more oxygen in lung. At the same time, you clear your secretion, especially people who are sick with pneumonia or COVID or anything. Their lungs are all filled up with fluid. This has to come out. And the added benefit is you are expanding your muscles. You are stressing your muscles, all muscles, including the diaphragm, the intercostal muscle, the back muscles, and we all talked about box breathing and everything. It's the same thing. So this is a small plastic instrument, which is a cylinder and also a mouthpiece, a corrugated tubing and a mouthpiece. What you do is, what one does is take a real deep breath, breathe out. And after you breathe out, put that mouthpiece in your mouth and slowly breathe in. Fill up your lung. And on the cylinder, there is a little piston which moves up and down. So the reason why it is called incentive, that let's say if you're breathing, take the first time you raise the piston to, let's say, 500 cc's. So that means you're taking 500 cc's of air inside. And your goal maybe is to get 1,000 cc's, 1,200 cc's. So slowly you graduate yourself. And this gives you an incentive to take deeper breath, deeper breath. We can, sometimes people ask, why do you need an incentive spirometer? Why can't you do it yourself? Sure, you can do it yourself, take deep breaths. But this is something which you can look, which you can observe. It's nice to observe something to see your progress. And the way it is done, Kalind, do we have somebody with a
Yeah, Bhavin is here. Let me see. Bhavin is there. Can you raise your hand, please, Bhavin? Unmute yourself, Bhavin, please. Unmute yourself. Unmute yourself. Thank you. Bhavin, welcome. Thank you very much for bringing the incentive. You and your wife, yeah, near.
You know what? I'll go to her computer.
Oh, there is.
I'm sorry?
I'll just go to her computer.
Yeah, go to a different computer. I think that's what's happening. Ruchi and you are nearer. Just wait 1 second. Hey, guys. This is a wonderful, Harish Bhai also has one.
Oh, there it is, yes.
Maybe Harish Bhai, unmute yourself, please. Didn't realize Harish Bhai also has one. That's good. So you can show it to him.
Show it put it by the camera.
Put it by the camera, okay.
Or unless, you can, if you can share the screen, you can get it on the picture on there.
No, I can share it. No.
Oh, there it is, yes.
Okay, you can, Harish Bhai, you can say something and you will be on a speaker mode. You can guys please select a speaker mode.
Hello, everybody.
Okay,
I'm on speaker mode.
Go ahead.
Harish Bhai, so let everybody see. Go behind a little bit so everybody can see the whole thing. That's better, yes. All right, go ahead. Just demonstrate it, how you're using it.
Talk a little bit.
First, usually like Vinod Bhai has said, you inhale and exhale, and then you put the mouthpiece and then inhale.
Oh, look at that, 1,500 cc's. That's fantastic.
And usually what they say between these two lines, arrow, the ball has to be between those two lines. So you cannot give too much or too less pressure. So again, let me come a little closer. And while exhaling, that you have to exhale very slowly. Now Vinod Bhai can guide it better because he's an.
Okay, yeah, that's wonderful. It's so nice that when you see a picture, it's easier to understand. So as you see, as you breathe in, the piston rises. And as the piston rises, you can see the amount of air you are inhaling. And then you reach your goal. I think when you, especially those people who have been sick, they know at what level they start, and they're given a goal what to reach. But again, you don't have to be sick. You can use this thing to exercise your lungs and take deep breaths and see how deep your breath you can take. And as I said, the advantages are you are clearing your lungs, you are exercising your muscles, you're stretching your muscles, and it's for general wellness. And basically, when you do it 10, 15 times at one time, not too much. Otherwise, it becomes too much. So you can do it several times a day, especially if you are suffering from any respiratory illness or you are recovering from respiratory, heart, or abdominal surgeries.
So Vinod bhai, there is a Bhavin and Kruti have another model they can show. Guys, you can come on and say something.
Yeah.
So mine is same as Harish bhai, and Kruti we have one more which is like 3 balls.
One is 600 cc, the other one is 900 cc, and the other one is 1200 cc. 1200 cc.
Yeah, it's a nice, colorful thing. So that's fine. Excellent.
So Bhavin is, can you demonstrate yours, please? Demonstrate yours, Bhavin.
Yeah, that's the one like Harish bhai. Yeah.
Harish bhai, yeah, demonstrate yours. You have to say something though.
What do you want to full
It's the same thing like Harish bhai. I mean, there is a piston on the side which needs to stay between 2 indicator. And there is a numbers written here, 500 to 4,000, and it will show you.
How have you been doing?
I'm doing good. I mean, when I was in hospital, I used to go only up to 500. Now I can reach up to 1,500.
So what were you in the hospital for?
I was in hospital for COVID.
You did.
Yeah.
So Vinod bhai is here. He can do a little bit of saying. Vinod bhai, you can ask him if you want to ask him some questions.
No, I think you're doing great. So how did you feel when just for the benefit of everybody, how did you feel when you were stuck by COVID?
I mean, I had the high fever and my oxygen level kept dropping.
Okay.
So that's why my doctor suggested to rush to the ER. And that's what we did. But in ER also, I mean, they have certain criteria who to admit and who not to admit. So
Right.
if your oxygen level is below 88 and you have a fever, then only they take you in ER.
Fever of 100
I had 102, 103 fever. So
I mean, when your oxygen level was low, how was your breathing? Did you feel short of breath?
not really. In the beginning, no. I did
See,
not
this is
feel
the
that.
important thing about COVID. When we discussed about the oxygen level, somehow patients with COVID, they will not realize their oxygen level is low because it is not reflected in the amount of shortness of breath. So this is misleading information.
And the reason why that happens, we have been teaching everybody this. The reason why that happens is that shortness of breath occurs not necessarily because of low oxygen, but it occurs because the carbon dioxide level goes up. That is what causes the shortness of breath. That's
But I think in Bhavin's case, I'm sorry to interrupt. In Bhavin's case, his carbon dioxide level was not going that high.
not high.
Not
That is
very
very,
high.
very good information. Thank you. Thank you for providing that information, because this is excellent information. When you have carbon dioxide level slightly goes up, the pH becomes acidic. The blood becomes a little acid. That is when the system, it tells the brain, hey, what are you doing? We cannot have acid so much build up in the body. The body, all the organs will not work. This is a kind of talk that goes on inside the brain, okay? And all of a sudden what happens is person starts feeling short of breath and then start breathing more and deeper. So I have one question for Bhavin. How was your breathing? Was it shallow or regular?
It was regular. I didn't feel
Regular
any. Yeah, I didn't feel any issues with the breathing though.
Exactly.
But once they gave me medication, the steroid, and at that point of time, I felt like I can't walk now. I mean, like what
That's
happened all of
something.
a sudden?
Yeah. So this is a very fascinating situation that we have been teaching everybody. We've been talking about it in normal people and people don't have COVID. But this is an excellent example. Now we can go a little bit more details, but I really appreciate Bhavin for sharing this with everybody, because this is an excellent example of how body behaves, and that's why they call it a happy hypoxia. Happy means happy hypoxia. That's what they call it. But the person does not feel short of breath because the carbon dioxide level has not gone up. Very good example. Thank you very much. Vinod bhai, anything else you want to add?
No, I think it's so nice to see he's well recovered and doing well. And did you have any X-ray changes that when you went in the hospital, Bhavin?
Yeah, they took an X-ray, but it was showing infection. So
Okay.
He had bilateral pneumonia, Vinod bhai.
Oh, he did. Okay.
Yeah. I was going to say Panana is a better person because she's seen the.
It is our nephew.
Oh, he's your nephew. Okay, good.
So
one small information for anybody. This instrument is not as expensive on Amazon. If anybody is interested, it starts from $5 to about $12-15 maximum. So if somebody wanted to get it from Amazon or somewhere, just for information.
very good. And Vinod bhai, only one small question before I turn it over to Pannavan is this builds up. What does it build up? What type of muscles, or what exactly does it build up when somebody practices this?
When it practices, it basically builds up all your respiratory muscles, especially the diaphragms, because you are breathing in. And as we have discussed before, the diaphragm not only improves your oxygen level, but in immunocompromised people, diaphragm also improves the lymphatic flow. And as we all know, the lymphatic flow is related to the level of immunity.
So you had mentioned last time, in one of our teachings, you had talked about the surfactant. I don't know, does the surfactant increase when you use incentive spirometry?
Well, not really, but what basically it does is open the airways. When you are taking incentive spirometry, you are getting more volume of air into your lungs. So
Right.
I think it's a balance between the volume, and it's like in a balloon. When you get more air in the balloon, it expands more. So that way, when you are breathing in, breathing a large amount of air, it opens up the airways, which I think takes place of the missing surfactant.
Yeah, in fact, we were teaching that, and I don't know if it's, but stretching open the alveoli, open them up very wide, increases the surfactant distribution.
Yes.
Whatever is happening, distribution all over the lung, and that really maintains the elasticity. Thank you very much. This is wonderful discussion. So I'm going to turn it over to Pannamen now for how do we prevent, how do we behave in this COVID world, COVID world.
Thank you very much. Before I start, I request everyone who does not have video on, this is a very casual, interactive experience. And as we all are practicing together, it is nice to see by Kalind bhai and Vinod bhai and everybody to see how everyone is doing it. So that would be great. Second thing is, I think Deepak bhai and Kalind bhai did Kapalbhati very well. One more point though. If you have a uncontrolled high blood pressure or breathing problem, or if you have hernia in your belly, you have to be very careful and not do it without doctor's approval. So with that, I chose the topic today. I think a couple of weeks back, I discussed about the breathing during COVID or preventing COVID and how not to get exposed when somebody have COVID, how to behave near them. Today, I have interesting topic. We all have been using mask for last more than 1 year. By now, we all are expert at using it. That's what we think. And CDC emphasizes still after everybody gets COVID vaccine, still we are not out of the loop, and still we have to use it. Why? Because it works two ways. If somebody have COVID, they cannot transmit. If you are wearing mask and you have to be in close proximity, social distance and sanitizing and everything is still important, but mask is very, very important. So mask has become like a routine when you want to step out, along with it's like your daily wardrobe, along with the key, wallet, phone. Fourth thing we all have to remember is mask. So none of us like to wear it. By now we are used to it, but there are some suggestions that experts are recommending to make it a little better, because there are some concerns. Some people say, oh, I have to wear it when I'm at work for a whole day. What's happening to me? I have to wear it when I'm not comfortable. So one have to be very mindful about their breathing. One have to take time and get used to wearing the mask at home before even you have to do it for a long time. Like start with 15 to 20 minutes, breathe with your nose, and don't breathe with your mouth. All those things we have been learning over and over and over. Breathe with your belly and not with your chest. Let's say after a little bit, everyone's tolerance is different. After a little bit, you feel tired of wearing mask. So in the bathroom or wherever where you have your own personal space, then take off the mask and, like Kalin Bhai have insisting, do the deep breathing with the nose into the belly. Do very slow, very deep, breathe out, and do it 3 to 5 times. And your breathing will improve, and then you can put the mask back on. Also, constantly be aware of your posture, because as you breathe, um, your lungs are stretching and your oxygen, more air goes into your lungs. So, and most importantly, change your perception that, oh my God, I have to wear the mask. Now it is the routine and we all have to accept. So sometimes people say, does it impair my breathing when I do that? Does it obstruct my breathing? Does it, when I'm rebreathing my air that I breathe out and I'm rebreathing, does it cause carbon dioxide poisoning? I think Kalin Bhai addressed that issue earlier today. When we, the carbon dioxide in the air is much smaller amount than in our body. So and our mask, when we wear good mask, it also lets the carbon dioxide go out, not that it always stays accumulated. um, when people work all day wearing mask, even for them it is not risky. Only people who have the breathing problem, people who have anxiety, and people who have emphysema, they should check with their doctor how long they should be wearing mask. um, so another thing, when we breathe through the mask, and sometimes there is a tolerance, we each of us have a different carbon dioxide tolerance. Some people feel easily air hunger. That means when they are breathing, they feel they have to huff and puff. So when you breathe, you should develop the habit and increase that tolerance for carbon dioxide, and you should breathe deep with the nose, while walking, while sleeping, while climbing, while doing anything. So let us practice a little bit. We'll do 5 times deep breathing with the nose. Put one hand on the chest and one on the belly. And let us breathe deep for 4 times and breathe out for 5 times. So 1, 2, 3, 4. Hold for 1 second. Breathe out. 5, 4, 3, 2, 1. Breathe in. 1, 2, 3, 4. Hold for a second. Breathe out. 5, 4, 3, 2, 1. Breathe in. 1, 2, 3, 4. Hold for a second. Breathe out. 5, 4, 3, 2, 1. Okay, instead of 5, let's do just 3 times. Um, so another test that we can do is the again bolt test. We all should be doing repeatedly bolt test, because as we have learned from Kalind Bhai, that more we practice bolt, more we try to hold our breath, our over the weeks bolt test score that may be, let's say, less than 10 or less than 20 does go progressively higher, and higher it goes, our tolerance for the mask wearing also goes up. So I know first time I did the practice with Kalind, by my score was 17, and right now it is up to 35 to 40. So it does go if you keep practicing. Does everybody have pulse ox? Does everyone practice? You can just nod your head. Does everybody practice? Harish bhai, you're the expert. So the whole idea is not by having this at home, but one should practice not only the bolt test, that is what we have learned. I need to breathe test. Bolt is I need to breathe, and that is done with the pulse ox. And the second thing is, I think our time is almost done, so I will kind of go fast. And the second thing is, I must breathe. So that is, we are challenging ourselves with the time. So, and if we walk by pinching the nose, timing ourselves, and walking, we would notice that those steps that we take before we must breathe also goes up slowly. And as our tolerance with this all these tests goes up, our tolerance for the wearing of the mask, some people say, how do you exercise wearing the mask, because it is very difficult, you have to breathe hard. But even that, you may need to cut back on the intensity of the exercise at first, but as you do it, even that can be done. Bottom line is, what we have learned, LSD. Kalind bhai, do you want to explain LSD, because you haven't done it? But
We'll do that. We'll do that next time.
okay, so let
Just
me
a little
just
bit more
tell
detail.
them what it is. It is, L is for light breathing, that we are slow and deep. So if we keep this in mind, LSD, light, slow, and deep breathing, practice it every day. And Kalind bhai will be teaching us more about it next time. And that's it for me.
Another one question. What do you think about double masking as you raised the question about mask?
So
Now,
up until many people we all are fixated on N95 mask.
right.
But CDC recommends that N95, at least early on there was shortage, that it should be kept for the professionals. Now they say good quality cotton double layer mask is good. Now they are saying 2 masks. But if it is one good mask, in my opinion, I think Vinod Bhai can elaborate on it a little bit more. But in my opinion, they are recommending 2 good cotton masks, but to me, one good cotton mask should suffice. Vinod
I
bhai?
think in general use, if you use one cotton mask is good. But if you're going to go to a very crowded place and or maybe traveling or something, it may not be a bad idea to have a double mask, which gives the double protection. But one more thing I want to add about the mask, if you practice right breathing, it doesn't hinder your breathing. But it is very important that you change your masks. And many times it has been found that when you're breathing in and out, you accumulate bacteria inside the mask. So you wash them, you make sure you air them out, and they have to be regularly washed and not keep on using them.
Good point. Very good point.
So thank you very much, everyone. I think this just shows us the idea. Before I go to my general comments for the time, I want to assure you something. Mask industry also wants to make money. And why do I say that? I don't have any stake in any of this, but I'm a surgeon. And surgery, we have been doing surgery without the N95 mask, surgical mask. Yeah. We've been doing surgery for 40 years. And surgery masks have been worn for a long time. And many times we also had cough, cold, something like that. And despite that, we have operated on people, open belly and everything. Forget the rest of it. How many times we have infected patients? Very interesting question. People are not discussing this part of it at all. We have been using mask has been my lifestyle as a surgeon. So I'm just raising an interesting angle here. Therefore, what Vinod Bhai says, a good cloth mask would probably be okay. You have to maintain the distance, that's for sure. You have a mask and then you start hugging people, that's not something good anyway. So, this is an interesting part. And what I want to stress upon everybody right now is the fact that